So, perineum. So, may
Ito kasi.
anal triangle and urogenital triangle. So, part of urogenital triangle. So, for the females, labia majora, labia minora. So, in between labia majora is the pudendal cleft. And then in between labia minora is the vestibule. So, here it is the vestibule. So, this is the bulb of vestibule. This is the Bartholin's gland. So, bulb of the vestibule. And then the clitoris. So, here it is the ischio-cavernous muscle. So, part siya ng part siya ng clitoris. So, tinanggal nila, the bulbous spongiosus muscle was removed. It is the covering for the bulb of vestibule and the Bartholin's gland. So, bulbous spongiosus muscle was removed in here to see the both structures. So, here it is...
Parang may naka-cover talaga dyan.
Oh, meron dyan. So, ito, this is the urogenital diaphragm. So, okay. This is the detrusor muscle of the bladder wall. So, this is the bladder. And then this is the ureter. So, we'll enter the bladder wall, posterior side. And this is the vagina. Vaginal canal with the muscle itself. And then rectum. And then this is the fallopian tube. So, and then this is the ovary. Fallopian tube has 4 parts. The infundibulum with the fimbriae, and then the ampulla, and then isthmus, the constricted portion, and then the intramural part. So, the fallopian tube is sandwiched between 2 ligaments. So, ovarian ligament or proper ovarian ligament, and then the round ligament of the uterus, from uterus to vaginal labia majora, and then ovarian ligament from ovary to uterus. So here again, labia majora, labia minora, clitoris. So here it is the pubic symphysis, and then this is the bladder wall. This is the urachus or median umbilical ligament. So the white one. So this is the external urethral sphincter for the females. External urethral sphincter within the deep perineal space. And then this is the perineal body attachment for some fibers of levator ani. External anal sphincter here. Also part of the bulbous spongiosus muscle. And yeah. And then vaginal canal, posterior fornix, and then anterior fornix dito. Tapos recto uterine pouch. Tapos dito recto vesico-uterine pouch. Yan. So, uterus has 3 parts. So, endometrium, the pink one. The red one is the transitional zone. So, 22 is the myometrium. And then this is the perimetrium. Yan. And then, it is covered by broad ligament at the sides. So, the broad ligament will also go to the salpinx or fallopian tube to be the mesosalpinx, and then over to the ovaries to become the mesovarium, and then at the lateral side of the uterus is the mesometrium. Scrotum, testis, head of the epididymis, body of the epididymis, testicular artery and vein. So the venous pampiniform plexus, will drain into the testicular vein, and then it will go to the spermatic cord, glands of the penis, shaft of the penis, detrusor muscle, vas deferens, and then it will unite with the duct. It will pass superiorly of the ureter, and then it will enlarge as the ampulla, and then ampulla together with the duct of the seminal vesicle will form the ejaculatory duct that will enter to the prostate. And then this is the prostate. Okay. This is the ischiocavernosus muscle covering the corpus cavernosus rectal tissue. So it's dito. So testicle. So head of epididymis, then tail of the epididymis, navicular fossa, and glands of the penis, corpus spongiosum, corpus cavernosa, and then pubic symphysis, and then suspensory ligament of the penis from the pubic symphysis, and suspensory ligament, and then at inside, this is the bulb of the penis, and then crus of the penis, and then the covering muscle is the ischiocavernosus muscle, and here bulbospongiosus muscle. This is the perineal body. Again, attachment for bulbospongiosus muscle, external anal sphincter, fibers of levator ani, and then also for the maybe external rectal sphincter. And then again, bladder wall, parts of the urethra, prostatic or intramural urethra, prostatic urethra, membranous urethra, and then the penile urethra or spongy urethra, since it is in the corpus spongiosum. And then specific parts in the prostatic urethra, it is the most distended part with the seminal collicus, and then prostatic utricle. Also, there is the presence of the uvula inside the bladder wall. So uvula will enlarge if the prostate will enlarge because of the connection between the two. Uvula is connected to the prostatic urethra via urethral crest. Urethral crest. And then on the seminal collicus of verumontanum, it will the ejaculatory ducts will drain into it, and the prostatic utricle is the homologue of vagina and uterus in females. Also, at the sides of the verumontanum or seminal collicus, or sinuses or prostatic sinuses, where the prostate ducts will end and will secrete their secretions. And then tapos we'll now go to the membranous urethra. So this is the most constricted part because of the presence of external urethral sphincter, also where the Cowper glands are found, and the ducts of Cowper gland will drain into intrabulbar fossa here. So the Cowper's gland is located at the deep perineal space, while its duct will end at the penile urethra, which is at the superficial perineal space. Okay. Also, in the superficial perineal space, the bulb of the penis is covered by bulbus spongiosus muscle, and then bulbus spongiosus muscle will be covered by another fascia or investing fascia of Gauledets. Gauledets fascia, investing fascia, or deep perineal fascia. While after that, it will be covered by another fascia on the superficial part. The shaft of the penis will be covered by callus fascia. So, pero ito muna, tunica albuginea, tas callus fascia, di ba? Dartus fascia, mga parts din. Okay na. Ito ba? Ito pwede. Here, it is the space of reduce. So, in between the pubic symphysis and the bladder wall. So, anterior bladder wall. So, space of reduce or pre-prostatic space or pre-prostatic space since before the bladder wall. Composed of the venous plexus, the vessels. So, since it is why it has a name, because of the vessels. Space of reduce. So here, urachus again, medial umbilical ligament, and then here the ureter. This is the 13 is the ureter. Number 18 is the wait. Ano ba? Oh, 18 is the vas deferens. Since it will go anteriorly, superiorly in relation to the ureter. It is superiorly in relation to the ureter when the ureter enters the bladder wall. Then ureter. So here, this is the testicular artery and vein, which is not part of the true pelvis, since it will go to the spermatic cord. While in females, its counterpart, the ovarian vessels, will go into the true pelvis. So in the females, the number of major vessels in the true pelvis is 6, composed of the paired ovarian vessels, so also paired internal iliac, and then medial sacral vein, artery, and superior rectal artery. While in the male, the testicular arteries are not found in the true pelvis. It will go to the spermatic cord. So in the true pelvis, it is only 4 of them. Determining the nerves of posterior abdominal wall. So for the subcostal nerve, which is T12, you'll first find the subcostal 12th rib here. This is the 12th rib. You can see that it is not going anteriorly, since it is a floating rib or vertebral rib. And then below that is the subcostal nerve or T12. So next is the L1, or composed of iliohypogastric and ilioinguinal nerve. So iliohypogastric enters the posterior abdominal wall in relation to the quadratus lumborum. So here, insertion niya. So quadratus lumborum. So this is the iliohypogastric nerve, and then it will go here to the anterior transversus abdominis. Here it is the ilioinguinal nerve in relation to the psoas major and quadratus lumborum, so in between them. Okay. And then it will end at the iliac, at the level of the iliac crest. It will pierces the transversus abdominis at the level of iliac crest. This is the iliac crest. And then here is the genitofemoral nerve. You can see it is cut, but it will end at the posterior, at the lateral part of the thigh. Yeah. And then here is the genital femoral nerve, which pierces the psoas major, and it will now go anteriorly, and it will branch into two, the genital branch and femoral branch. Genital branch of genitofemoral nerve will go inside the spermatic cord and will innervate cremaster muscle and other parts. And then femoral nerve is in between the psoas and iliacus. So here, femoral nerve in between the psoas and iliacus. So ano pa ba? Obturator nerve can be seen inside, but I can't. But again, for the posterior abdominal wall, subcostal nerve, iliohypogastric, ilioinguinal, genitofemoral, lateral cutaneous nerve, lateral femoral cutaneous nerve, and then genitofemoral.